Hi, thank you for coming. Today we'll be doing a training session for bone density building and muscle tone building. And I like to start always with some soft tissue work and alignment exercises. So we're going to start out, as we regularly do, with a massage ball or a tennis ball. And the chest, the muscles in the chest, the pectoral muscles. Why I like to start here is with our arms forward, the pecs tend to shorten, and that causes our shoulders to roll forward and heads go forward. And so here you see I moved so that I could be in a corner of the wall, or you can set up also a door frame. And the head should be on the, so the side you're working on, your head is turned away from that side and down. So you should not feel tension in the neck, should feel just quite comfortable. Okay, so then if you could lift the arm up a little, you can get the pec tendons here that attach around the shoulder and the humerus. So you lift the arm up. And if you can work around the head of the humerus is the upper arm bone, just right around the head. Okay, and then we'll switch to the other side first, just below the collarbone into the pecs. Here the hand should be facing the wall. Okay, and then bring the arm up, and then by the underarm, and around the humerus head. Okay, and so next, we'll continue with the soft tissue work. And now we'll work on the upper back, and starting here with the upper trapezius. So I'd like to make sure to get also levator scapula right here along the edge of the base of the neck. So to do that, you angle, your feet are forward, so your body's on an angle to the wall, and you can get right around that corner, right across levator scapula. And then here still at the base of the neck, on the upper traps. Okay, so now we're going to go a bit more side to side. So you can go like that sideways or up and down across the upper traps. And if it's particularly sore, sometimes I just put pressure into it. Okay, and then if you bring the arm across your chest, and it brings the shoulder blade out to the side, so you can work right around the edge of the scapula, the shoulder blade. And here, you can move up and down in the muscles between the spine and the shoulder blade, but do get right at the edge of your scapula. Now here, that's more middle trapezius, and if you go a little lower, so more at the bottom part of the shoulder blade, then that's the lower trapezius. And when the lower trapezius isn't sufficiently strong, the upper traps are more dominant, that causes the shoulder blades to get elevated. Okay, now infraspinatus, so the teres minor here, if you turn sideways, these are rotator cuff external rotators. So right here by your armpit, and you can do a bit of external rotation or just move the ball around. And there's usually a point that's really very intense. And if you find that point, you can just hold and try to relax your arm. Perfect. Okay, we'll switch to the right side here. So first at the base of the neck and the arm just in front and across a bit. Okay, and side to side or up and down over your upper trapezius muscle. And if you can get under the upper traps a bit, you can get to the supraspinatus. Okay, and now out further by the shoulder. This time do get the arm across your chest or elevate the arm so you can feel the edge of the shoulder blade. And the subscapularis muscle is underneath the shoulder blade. So when you move your arm across like that, you expose the subscap. Okay, now take the ball a little further down, so more into the lower trapezius area. Okay, and now to the side. So at the edge of the underarm, you can move around a little or just get the ball in place. That's very encouraging. Earlier when I did this with a class a few hours ago, it was really quite sharp when I put the ball here, and currently it's better. Like I don't feel it at all. So you might test yourself later on in the day as well. The difficulty is if you don't release some of these tense or these trigger points, they just accumulate more and more tension and then, cause breakdown. All right, so now we'll stay here and work on the hips. And we're going to work similarly around the edge of the femur. So femur is the big bone in the leg. And right here is going to work around the head of the femur, which is the socket of the hip where the femur attaches. So right on the side, and I like to feel the edge of the femur and work around the edge of the femur. And then a little further down. So you're going all around the acetabulum, that socket. And often it's right here, I would say about a 45-degree angle where, when you externally rotate your leg like this, that you get pinched here. So that one can often get a bit sensitive, that spot. Then more beside the coccyx by the tailbone. Okay, so now the sacrum is like a wedge like this that sits in the pelvis. Now we're going to work our way up along the edge of the sacrum. So you can have contact, feel the edge of the sacrum, piriformis muscle, and here you can go side to side across the glutes. That always feels quite nice. And work your way up again, horizontally across your glutes, up and down, whatever you like to do. Hopefully there are no big knots in there. And then there's a corner. So here's the sacrum and the iliac crest meet. So there's a corner right there. So if you could try to get right into that corner. And then we'll follow the edge of the iliac crest out to the side. And generally, again, here, this kind of like a curve of the pelvis, and then the muscles in there get a bit jammed up, and so you can dig into that corner. And often here, people feel radiating down their leg or numbness down the leg. Okay, now we'll switch to the right side. So first around the head of the femur. And so many of us, I think driving is a factor, but then also just right side dominance and other factors, and anatomical positioning of our organs that affect the right hip. Okay, now take the ball a little lower, more on the outer lower edge of the femur head. Around the trochanter. Okay, and then lower by the tailbone. Okay, and now we'll turn more toward the back. And work up along the edge of the sacrum. And here side to side or up and down as you like. Okay, and in the corner where the sacrum meets the pelvis, and then follow your way out to the side. Now more on the side of the hip, that top corner of your pelvis. Okay, so for the training, I find those are the most critical areas. We'll do the quads on the floor. So on your own, you might spend more time, you can work the rest of the body. But that will help allow your rotator cuff, the shoulder blades, and your hips, joints, ball and socket joints to move more comfortably when we're loading them. So now we're going to go to the floor. I'm just going to try to set this up lower. And I'm sorry, I heard my friends in Hawaii, they having some really severe storms and a lot of heavy rain. My friend in Canada has another foot of snow. And my good fortune is to be in Costa Rica for this winter, and it's been quite spectacular. Okay, so on the floor, you're going to need a broomstick, the massage ball, a strap for stretching, and I use a rolling pin, but something like a foam roller or a rolling pin when we work on the quads. And we're going to start working on the back of the neck. You might need a book. If you put the ball on top of a book, you can get a better angle. But you might not need a book. It depends on how acute the extension of your neck is. But then you want to hold on to the ball with your hand and just put pressure. You can massage out the muscles in the neck, but more specifically, we're working on the base of the skull, the attachment of the suboccipitals. And you start in the middle and then work out toward the ear where you feel a bit sore. Then we'll switch. A couple of days ago was my 62nd birthday. So yesterday I treated myself to having a massage at the beach. And the massage ladies, they have their table and you're under this shaded tree and it's sunny and it's shaded where you are. It's perfect temperature. And now ball behind the head and the back of the skull and chin angled slightly down. And gently nodding. And take a deep breath. And of course you hear the waves of the ocean and the birds in the background and the ocean breeze like that. And it just reminded me when you're having a massage at a spa or something, they try to create that environment. And this was the real environment. And it was really very soothing. And just nodding a little. And a deep breath. Okay, now keep the head with the chin angled down and only the eyes look up and down. And a deep breath. Eyes look up and down. And a deep breath. Okay, so now we'll put the ball aside for now. We'll come back to the feet when we stand up. And now the strap. So the strap goes under the right foot. The leg is knee over hip. And the shoulders here should be relaxed to the floor. So you're not pulling really hard. Shoulders are down and more. You just let the weight of your arms pull with your strong grip. Okay, then if you take both ends in the left hand, wrap it around the back of the calf in the right hand. Now keep the leg really, really stiff. And you want to rotate the leg, your femur, you're rotating in the acetabulum, which we just worked on. Then unwind. And just pull a little, and you can push with your foot. That will help strengthen the tendons and the joints down your leg. Okay, and switch legs. Okay, so right leg is down, left leg up. Okay, knee over hip. And take both ends of the strap in the right hand, wrap it around the back of the calf muscle. Keep the leg very stiff as you rotate your femur. Unwind. And then just stretch. Okay, and rest. And now broomstick. So in the back of the right leg and the hamstrings of the right leg. Pull the left leg up into it and the quads of the left leg. And just pressing the legs into the bar. This will help the alignment of our pelvis and our shoulder girdle. Okay, and reverse the legs. So next year, I'm hoping, if I can manage, to go to Hawaii for the month of November. And then Costa Rica, December, January, February, March. That's what I'm aiming for. And so everybody's invited. I don't have visas to work there, but you can do things just for free. Broomstick down. Arms out in the Y angle. So I did some of that in Hawaii. I had a really nice yoga hale. And this year I did a bit of that on the beach here in Costa Rica, and it was really fun. Okay, imagine a big stability ball on your abdomen, and you can wrap the arms and legs around the ball. And then we'll just rock side to side, and make sure you use your core strength so you don't let the lower back collapse. Should be very stable between the hips and ribs. So I think, officially, not maybe really officially retreat, like, because you need visas for that and rest. But, definitely training sessions on the beaches in Hawaii and here in the afternoons. And in the mornings we had at the yoga hale in Hawaii. Some sessions it was really fun. Okay, arms and legs up now, bring dead bug position. Shoulders are down, lower back, make sure lower back has a bit of an arch. Right leg push forward and hold. And left leg. And right. And left. Okay, rest. Okay, now we're going to work on spinal rotation. So you lie on the right side, the left leg goes forward, the left hand reach back toward the right foot, right hand on the left knee at the front. So you see here the left shoulder, wherever it is for you, everybody will be different, but it's a few inches from the floor. The left knee on the other side should be the same height from the floor. And that will help even out the rotation of the spine. See, if you rotate the knee all the way around, then we'll turn to the other side. Then that will over-rotate the lower back. So we want to make the proper rotational axis all along the spinal column. So now lying on the left, the right leg goes around. Right hand reach back toward the left foot. Left hand on the right knee. Right shoulder back. And the right knee is forward. Both equal distance from the floor. Perfect. Okay, so now we'll work on neck strengthening. So you can have your hands either on your abdomen or under the lower back. Okay, right leg is bent, left leg straight. And often people say this, right? Like you have a string at the top of your head and someone's pulling it. But if you can really actually very, very sincerely and seriously envision that, like feel that someone's got your string top of head and they're going to pull that string. The purpose is to elongate the spine and decompress the spine. So that's good. But if you can tuck the chin at the same time, that will angle the skull down, and then that will help to strengthen the neck to be able to maintain the length of the spine so that when you stand up, the whole thing doesn't just collapse. Okay, so relax. Now we're lengthening top of head, chin toward throat, keep the chin angle down, then elbows lift a little, head lift. If you can keep the chin in that position to strengthen the muscles to keep the spine lengthened so you don't lose height. And down. Again, reaching from the top of the head, chin in, elbows lift, head up and hold. And down. And again, lengthen, chin in, elbows lift, head lift and hold. Okay, rest. Right leg straighten, left leg bend. Why we do this with the legs, it helps you to use the rotational core stabilizers. Lengthening from the top of the head, chin in, elbows lift, keeping the length of the spine, head up. And rest. And now this will integrate the diaphragm, lengthening, chin in, elbows lift, keep the length of the spine, head up, deep diaphragmatic breath. And rest. And one more time, lengthening, chin in, elbows up, and head up, and deep breath. Good. Okay, so now back to the strap for the hamstrings. This time we'll just do a stretch under the right foot. Knee over hip and straighten. Keeping the shoulders back and just letting the weight of the arms essentially pull on your foot, and you can resist with your foot. Okay, then switch legs. And if you can't straighten your leg all the way, that's okay. Just keep whatever angles were comfortable for you. Left leg. And for the purposes of our class, you don't need to be like the dancer, pull the leg closer to you. In this position, we want to lengthen and strengthen the tendons down ankle, knee, hip. For everyday life, you don't really need to overstretch. And rest, that's perfect. Okay, and now the broomstick. So in the back of the right leg, the hamstrings and the quads of the left leg, and just press. Keep the arms straight. Keep the chin down. Okay, and switch the leg position. Okay, down. Arms out in the Y angle. So here, if your shoulders are maybe have less range, then you won't get the arms up so high. That's okay. But shoulder the back of the shoulders into the floor. And chin always in toward the throat. You may also prefer to have a small pillow behind your head if that's more comfortable for you. However, you do always want to lengthen the back of the neck. And rest. Arms and legs up for the cradle rock position. We're going to rock left and hold. And rock to the right and hold. Okay, and center. Okay, so arms up to the sky, bend the elbows 90 degrees, knees over hips. Right leg push forward a couple of inches, hold, always maintaining the integrity of the lower back. So lower back shouldn't flatten, right leg back, left leg forward. When you straighten the leg like that, shouldn't increase the arch, you're maintaining your neutral spine angle. Left leg back, right leg forward, hold. So when you bring the leg back, your back shouldn't flatten. Left leg forward, when the leg goes forward, it shouldn't arch. It's always just a bit of an arch in the low back. Left leg back, that's perfect. Okay, and now the spine rotation angle, right leg straight, lying on the right. Left hand reach toward the right foot, right hand toward left knee. Okay, and now we'll turn on the other side. So if you've been doing, a lot of gardening or golfing or snow shoveling, when we switch to this side, right leg back. Right hand reach toward the left foot, left hand on the right knee. So if you've been doing or playing baseball and swinging a baseball bat in this right-sided direction, when you come to this side, people will often feel the right side is really tight. And our aim is to do our training to keep ourselves balanced, despite the fact that we do all these really fun rotational activities. That was really great. Okay, so now we're going to release the quadriceps. We'll just try to tone them down a bit. So here you can sit up and use a foam roller or rolling pin and just roll it in the front of your legs. I just have this rolling pin here. We're going to start on the right leg, only one leg at a time, just above the knee. And then incrementally work your way up to help the fascia rehydrate. So as you squeeze like this, as you're pressing on your quads, you're squeezing the fluids out and lengthening the fascia, and the fascia can rehydrate with more nutrients, better quality fluids. I like to rotate the leg in slightly different angles. And when you come to the top, you want to make sure you get onto your TFL outside of hip. And also the hip flexors, the front of the hip. Here, and same thing when I was in Hawaii, switch legs, left leg, that when people, see us doing our exercises at the beach, and we have people have just been using water bottles here. They bring a filled up water bottle and a towel, and most people have a TheraBand, something like that. So we have a pretty filled up weight room actually. Works really well, and onlookers are always very interested and comment about what a great idea it is and what a beautiful gym it is. Under the shaded trees, over the ocean, it's really quite spectacular. So when you get to the top of the leg, make sure you want to be on the outside of the hip on the TFL and the front of the hip on the hip flexors. Okay, so from here, we're going to do a couple of things for aligning the spine and the pelvis and releasing some of the tension in the hips. I think we'll keep this going on this particular session of the week. So first on hands and knees. The objective is, so here's your hips, right? The pelvis, they're like this. And you want to just tip the pelvis like that, okay? So you have your leg. So say this is your femur, your leg, one of your legs, and here's your pelvis, right? It sits in the pelvis. So what we're trying to do is just like this, is tip the pelvis up and down using the gluteal muscles and the piriformis on that side, okay? So it's this leg, the one that's on the floor, that one supporting, that engages, and that pulls the pelvis like this, that causes this tipping action. We're not doing a twisting like this. It's not a rotation, it's just a directly lateral lifting up and down. For obturator internus and the piriformis. So it looks like this. I'm sorry, I can never figure out what's a good view with this one. So my left leg is supporting, right leg is straight. You keep that leg really straight and you just tip the hips up and down like this. Just like I described. You have to be careful. You don't want to twist the lower back. Okay, everybody ready? You may have already started, but we're doing right leg up and left hip strengthening. The elbow should be straight here, so you've got good support from the shoulders. Okay, and now rest. Okay, now we're switching sides. So right leg is supporting. Shoulders are down from the ears, press the hands to the floor. Left leg up, left leg is straight and flexed. And then rotate without hyperextending the lower back. So the neutral spine, right? You have a little arch in the lower back, but it shouldn't collapse down into a bigger arch. The outside of the right hip, that's what you should be focusing on here. Okay, rest. Okay, so now we're going to help the femur to rotate in the hip socket, go to full range of rotation. So we'll start with the right leg crosses behind the left leg. So again, like a pigeon idea. But you want to stay square forward with your body. Don't just collapse that hip down. So the hips are actually always square forward. My hips are square, but the femur is rotating in the hip joint. Okay, and then wherever you get to, we just hold there. So you see the body's not really twisting in any angle, and I'm not twisting the knee. It's just, you see that's a straight bend in the knee. It's the femur over here on the outside of the hip that's rotating in the joint. So that's what we're looking for. Okay, and now we'll switch sides. So we're going left. Here I'm crossing left leg behind the right leg. And don't just crash down onto the right hip. Okay, keep the hips square and the shoulders are square. We're not twisting. And the knee, so there's no torque in the knee joint. Shouldn't be twisting the knee. Okay. All right, and so now for the strengthening component, if you have a band that you can put around the knees, or sorry, around the legs, we're going to use this again later on in the training today. We'll be doing our band walks or monster walks, as it's commonly called. But for here, the band goes just around the ankles. Okay. So this is to strengthen the hip rotators. The knees are directly over the hips. And arms by the sides, palms down. And then when you take the knees out, you don't go like that, but you take the feet and with you. So you take the knees away from each other. You see, I can't do that. I have a really strong band. So you just do what you can like that. And then rotate the feet out. Then rotate the feet in, come back to middle. Knees out, feet out, release middle. And always your lower back should keep that neutral spine position. And rest. This specifically is for the obturator internus, which is an intrinsic stabilizer. for the femur and the hip joint. Okay, second set. Knees out, feet out, and release. Keep the chin down always, so we all know that. Shoulders back to the floor. Okay, rest. So if you're mostly feeling it down here on the IT band outside of legs, this time, before you initiate the action, try to engage the outside of the hips, okay? So let's do that one more time. So before you start pulling, you go glutes engage outside of hips, then knees out, then rotate out. Release it, glutes, the sides of the hips, knees out, feet out. And rest. Okay, so we'll take that off. And now we're going to stand up. Now we're ready to start doing our weightlifting. We're going to do deadlifts. We've been practicing for a few weeks in our current phase of training. One arm wide stance. So this is the time when you would use a heavier weight. And we'll be doing just 2 sets of 15 reps on both sides. You know, on your own on another day, you might do a third set or even 4th or 5th set. But generally when we do the single arm positions or single belly position, I like to do 15 reps with the deadlifts. Get an angle. Okay, so everybody's got their weight, we're all ready. Now there's one last thing we'll do before we start the lifting, the feet. So if you could get your ball, the massage ball we used earlier. Now it probably feels pretty good because, you know, when you work on the rest of your body, your feet are integrated. So usually whatever area will feel better after you've done all the other parts. Switch to your other foot, roll it around a bit. So for me, that feels like really fine. All right. So the position here, we want to externally rotate. The shoulders are too much this way, so we want to externally rotate the shoulder. Palm is facing forward. And we're doing a wide stance. The weight is in between the legs. You don't have to go too wide so that when you're doing your hinging action, the knees are tracking the same direction as toes. Okay, left hand hold onto the weight. Chin in, make sure your body is centered here, and to push the hips back. Here at the bottom, engage your glutes to stand. Hips back, glutes engage from the sides, just like we practiced a minute ago. Glutes engage from the sides to stand. Okay, and rest. Okay, for those of you who do this regularly, I think you know, right? That felt good, didn't it? The hips feel really clear. Okay, right side, palm face. So right hand, palm of the hand is facing forward. Keep the shoulders and hips level all the time. Push the hips back. Here, glutes engage evenly, right and left side. Okay, and rest. All right, so now we're going to do another series of the same. This time I'd like to focus on the angles of the feet and the knees. So when you're doing your hinging action, like this, the knee, just sense that the knee is going that same direction, okay? Same direction as toes. The feet, so we'll just set up here, so same position, wide stance. The focus here is going to be the feet. Before you start doing the lifting, get a sense, the heels, outside the feet, all the toes are down, the arches are lifted. Now when you go into your hinging, you'll notice the big toe will want to lift up. So you must always keep the big toe gripping to keep the arch active. Left hand, palm forward, chin in, hip hinge back, press the feet into the floor, avoid lifting the big toe. And rest. Good. And now right side, right hand, palm forward, chin in, toes pressing, arch up, hip hinge, keep the big toes down, knees go in direction of toes. Okay, and rest. Great. Okay, now we'll put the weight down. Okay, so next for upper body lifting. Today we're going to do overhead press followed by band walks, again working the hips, followed by bicep curls. The weight here, not too heavy. See, you can decide for yourself. I always like to have elastic around the toes, the two big toes, and then I put pens. These are not pens, but something like that, right here on the outside arches, just the tips on the outside arch. That really helps your feet work more. So I'm using a little heavier weight according to me. So I'm going to do about 7 reps. If you have a really light weight, you might do 10 or 15 reps. But if it's heavier for you, just do it whatever number feels appropriate with the weight that you have today. So I'm putting the pens under and elastic around the big toes. Okay, now my feet are ready. Feels really good. We're starting with left arm pressing. The angle of your arm, you can either have the arm in front like this, neutral grip position, or a little wider or a little wider, or you might vary it from set to set. If you're in a position where you can't stand up for now, you can instead do lying on the floor, chest pressing. Okay, left arm, standing tall, chin in, and exhale, press. And rest. And right arm. Chin in, lengthening, like we said, lengthening from the top of the head. Exhale, press. Okay, rest. Great. For the second set, we're going to pay attention to the weight relative to the elbow. So the weight should be over the elbow joint as you're lifting throughout the action. Sometimes people let the weight drop in this way, so the shoulder internally rotates. Okay, left hand. Okay, just think, where is that weight? Where the elbow? Keep the weight over your elbow. And rest. And right arm. Chin in. Make sure the weight is set correctly. Don't let the weight fall to the chest. And rest. Okay, good. So set 3. But this time we'll pay more attention to the posture. So we're getting pulled up or reaching the head up, but at the same time, chin in. As you do that action, you should feel your abs are engaged. Do not lock the knees should be soft. Left arm. Set your posture. Rest. Okay, right arm. Chin in. Standing tall. And rest. Okay, so next, the upper traps, this one up here, okay, when you're lifting, shouldn't feel that one. This stays down, keep the shoulder down from the ear as you lift overhead. That helps the shoulder blade to come under the armpit and then without overusing the upper trapezius. Left arm. Okay, shoulder down from the ear as you press. And rest. Okay, then right arm. And rest. All right, then we'll put the weight down for now. So now we're going back to the hips. And similar to what we did earlier, the hip external rotators, this time you'll need that band again, the one we used earlier. And this time though, the band goes around the knees, or just above the knees, not right on the knees, up into the quads. You know, there's a few things we're doing, it's called monster walk or lateral band walk. A few things that you don't want to let the knees go forward, then you just use your quads. You want to be working the muscles of your hips. So you push the hips back like this, like we did earlier. And the steps, the mistakes people make are they make steps that are too big. It works way better if you do really small steps, very, very small steps. Okay, so we're going to start going toward the right. So you've got some tension. Make sure the knees and toes are pointing same direction. Don't out toe. Okay, ready? Arms up, hip hinge. Small steps to the right. Left. And stand, offload. Okay, and now we're starting toward the left, so you go hip hinge back, left. Keep the chin in. Right. And rest. Okay, now back toward the right, hip hinge back, right. Left. And rest. Okay, and now hip hinge back, left. Right. And rest. So you should mostly feel that here, right here on the outside of the hips, the hip external rotators. Okay, we'll take the band off. Now back to the weight that we were just using. We did overhead press, now I'm just going to do one arm bicep curl. So again, I'm going to put those activators for the lateral arch on the outsides of the feet. So you might put pens on the outside arch, the lateral arch, and elastic around the two big toes. All right. We're doing one arm because I find that helps people keep their alignment better. When people use two dumbbells, they're a bit skewed. So left arm first. The grip is like this. The palm of your hand is facing your leg. Okay, so that's reverse grip. Okay, wrist. Right arm. Palm is facing you at the bottom. Palm is facing forward at the top. And rest. Okay, now neutral, that's called hammer curl. The palm of your hand is facing your leg and it stays at that angle all the time. So here at the top, the palm of the hand is facing that way. Left hand, chin in. Okay, rest. And right arm. Okay, rest. Okay, now we're doing another set of each. Try not to use momentum, so it's not like you're swinging the weight like that. When your arm comes down, don't let it swing behind you to get momentum to lift. The elbow should be always just set, not touching the side, but by the side. Shouldn't be going back and forth. Okay, left hand, palm facing you, reverse grip. Okay, rest. Right arm, reverse grip. Use the glutes. That's good. Don't lock the knees. And rest. Okay, hammer curl, left hand. Palm is facing you. Keep the chest open, chin back, chin slightly down, glutes. Knees are a little bent. Okay, rest. Right hand. Okay, the palm is facing your leg. Chin in, glutes, soft knees. And rest. Okay, and thank you very much. It's really good to see you. Have a good week. Hope everything's going okay. Sorry for some of the storms, but hope everybody that we love and care for will be all right. Take care, everyone.